Charlie Brennan, the voice of St. Louis. Well, if you have a nose, listen to this. Because if you are living in St. Louis, you probably have experienced allergies through the years. But the question is, are allergies worse than they were years ago? Are there more allergens? Are people suffering more today? Are there people who didn't suffer in the past but are now? Well, USA Today last week had a story on how pollen counts throughout the United States are up. The pollen seasons are longer. Many people are attributing this to more carbon dioxide in the air, where we might have had 280 parts per million around the turn of the 19th and the 20th century. We're now up to maybe 400 parts per million in the United States. So there's more CO2. It makes the world a little bit warmer and the growing season longer. It's good for corn farmers, but may not be good for the rest of us. Let's check in with St. Louis native Dr. Brian Rotskoff, allergist at the Clarity Allergy Center in Chicago, joining us today on The Voice of St. Louis. Dr. Rotskoff, thanks for taking our phone call today.
Oh, thanks for having me here. It's a pleasure to be on.
Where did you grow up in St. Louis?
I grew up in Creve Coeur.
And your high school, of course, was?
Of course. I waited for that. John Burroughs High School.
Well, an outstanding school, and it's great to have you back on KMOX. Let me ask you this. Is business in Chicago for an allergist up today over previous years?
What I can tell you is it's simply unprecedented. Starting about 2 months ago, we were getting calls from 10 to 12 patients a day demanding to be seen. And I say demanding because they weren't waiting till tomorrow. They weren't waiting till next week. We had to find nooks and crannies to squeeze them into because they just could not get through their day. So it's been off the charts, unprecedented, and we are working around the clock to try to keep up with the demand.
Are there in Chicago volunteer pollen counters who are actually taking measurements of the pollen in the air?
Well, there's one practicing allergist. He actually just retired, Dr. Leha, who gets up every morning and around 5 in the morning he takes the pollen counts every morning. So we all get those emailed to us, and they're readily available, and they've simply been off the charts.
So the phone calls are up, and so are the pollen counts.
That's correct. It's not just the actual pollen counts that are troublesome. It's the pollen seems to be changing in the character. It's kind of like pollen on steroids. It's having a major impact on the immune systems of people out there who are suffering from allergies.
Well, apparently the average plant now has about 10 mgs of pollen on it, where in the past it had about 5. So it seems like the plants are more potent than they were.
Yeah, so it's the quantity of the pollen and the potency. That's exactly right. And it seems to be that it may be impacting our immune system, particularly at an earlier age. And it seems to have an impact on the immune system to cause more allergies. And that's probably one of the reasons we're seeing cases much earlier, and particularly in those in adults that you were alluding to that have had symptoms now when they've never had those in the past.
Well, Dr. Rotskoff, this has been a cool year, right? A cooler spring that came later. Why would the pollen numbers be off the charts?
Well, if you notice, we did have a lot. It was a very wet season, so we had a lot of rain, and you're right, the temperatures were cooler. And what we actually saw was a delay in the pollen counts rising. So typically the tree pollen starts in March and April, but it was delayed several weeks this year. And I was talking to a colleague of mine and asked him if he had seen anything with the pollen with patients coming in. He's like, oh, not really. And then all of a sudden, third week of April, it just hit like a storm. And we're seeing delayed pollen counts rising, but what you're seeing now is from the warmer weather we're having now with the rising precipitation that we've had in months past. It was kind of just bottled up, ready for the warmer weather. So when warm weather comes, it's just hit in full force.
Dr. Brian Rotskoff with us, allergist at the Clarity Allergy Center in Chicago, St. Louis native, went to Burroughs, and is noticing pollen and hay fever suffering like never before. Well, now, some people think of these allergy symptoms as watery or itchy eyes, but they go way beyond that. I mean, even sleeplessness can be a sign of an allergy, correct?
That's correct. The main symptoms are itchy, watery eyes, sneezing, nasal congestion. And the nasal congestion is a problem because, as you were saying, people can't sleep at night, and we all know what happens when people can't sleep. And to give you, I have a couple examples of the severity of patients I've been seeing lately. I had a high school student in 2 weeks ago. He failed his calculus final examination. He couldn't study. His eyes were bothering him. He couldn't sleep. And his grade went from an A- to a C+. So that was a pretty big deal for him. And another patient who's a surgeon, his nasal congestion was so bad, he's just having trouble sleeping at night. And that's obviously not a good thing when a surgeon can't sleep. So what we're seeing this year is that people with mild symptoms last year, or even no symptoms at all, they're not coming in, and they just can't take it anymore. They've had enough, and they're at their wits' end. So that's a big change that we're seeing this year.
You're so busy. I was going to ask you to stay and take a few phone calls, but I don't know if you can.
Oh, I think for you, we can take a few minutes. No worries.
Okay, it's 436-7900, 800-925-1120. Let's line up some phone calls, and we'll come back in 2 minutes. How about with Dr. Brian Rotskoff, and we'll take phone calls. How about you in St. Louis? Are you suffering from allergies like never before? What's your situation? Are you having some of these symptoms? 436-7900, 800-925-1120. Dr. Rotskoff, allergist at the Clarity Allergy Center in Chicago, our guest today on KMOX. We'll be right back with your phone calls. Charlie Brennan on the Voice of St. Louis, and our guest on the KMOX Phoenix Group guest line is a St. Louis native and now an allergist in Chicago. Dr. Brian Rotskoff joins us. He's with the Clarity Allergy Center in Chicago and was profiled last Friday in a story in the USA Today newspaper indicating that allergies are much more intense in this nation. Now, before we get to some of these phone calls, do you think there's an association between the increased pollen in the air and the increased amount of carbon dioxide in the air, Doctor?
Yeah, well, there's obviously some controversial issues regarding climate change, but I think one thing that is not debatable is that we are having warmer temperatures. And warmer temperatures have been associated with rising carbon dioxide levels. So I would say, yes, climate change has led to the increased carbon dioxide levels. And as I was saying earlier, carbon dioxide is like steroids for the plant pollen growth. So it turbocharges the plant pollen production. So we're seeing much higher pollen counts related to the pollen to the rising carbon dioxide levels. And
longer pollen producing seasons in places like Chicago and Fargo and Minneapolis, right?
Exactly. So the warmer temperatures and the wetter environments lead to longer pollen season, and the carbon dioxide levels lead to the rising pollen count. So it's kind of this double whammy with the weather changes and the rising carbon dioxide level.
Do you buy into the theory that a lot of us are suffering from allergies because as kids we're using things like Purell to get all the germs off our hands?
Yeah, that's the hygiene hypothesis, where the less things we're exposed to germ-wise as children, the less protected, or I should say, the more protected you are from things like allergies. So that's certainly one of the leading theories. I think there's probably some truth to that as well. But I think one of the big things is the climate change, the rising carbon dioxide levels. That seems to be changing the character of the pollen, the potency of the pollen, and the amount of the pollen rising. So I think it's kind of like this vortex of environmental factors that are hitting us all at the same time.
The perfect storm. Perfect pollen storm. Dr. Brian Rotskoff with us, allergist at the Clarity Allergy Center in Chicago. Let's get to the phone calls, and we'll start with Josh on line number one. Hi, Josh.
Hi. I had a question around the symptoms of allergies, in particular related to nasal congestion, compared to a potential sinus infection. Like for allergies, do you typically have, colored mucus, etc., or is it typically, non-colored, and colored would indicate maybe a sinus infection?
Yeah, that's a great question, and one of the things that's hard to distinguish between an allergies and a common cold is one of those factors is the green discharge, the discolored nasal drainage. You typically see that with either a bacterial or a viral infection. With allergies, you tend to see clear secretions from your nose, so not much discolored drainage when you have allergies. And you'll also have more sneezing, itching, runny nose with allergies. And one thing we look at is the time course. So if you have symptoms for 7 to 10 days with discolored nasal drainage, greenish discharge, and that resolves in 10 days, that's most likely a viral or bacterial infection.
Whereas, I'm sorry, go ahead.
Go ahead.
No, do you recommend a lot of people, obviously see an allergist, or can a lot of these situations be remedied by some over-the-counter Claritin?
Right. So for the mild symptoms, we have some very good over-the-counter medications like Claritin, Zyrtec, and Allegra. They're non-sedating, last 24 hours. So that's a good first choice for a lot of patients. And then, but if those aren't helping, and this year we've seen many patients who just aren't responding to the traditional arsenal of medications, then it's time to see a doctor. And if it's really bad, you can see an allergist, because we can do the specialized skin testing to find out exactly what a person's allergic to and use some of the stronger, more potent medications if need be.
Jim, you're on KMOX.
Hi. Yes, I've had this thing since November, this drainage in the back of my throat, and it never stops. I'm always clearing my throat. This year with the ragweed and everything, I used to never have allergies, or maybe I had them, just didn't know it as a kid because I was born in the 50s. But what do you think's going on with this drainage thing all the time? And it's been months and months.
Could it be something other than an allergy?
There's always a number of things it could be. Allergies are certainly at the top of the list. There's other things such as we have non-allergic inflammation in the nose, and those aren't caused by typical allergies. They respond to similar medications. So if you haven't tried one, maybe a nasal steroid spray like Flonase could potentially be helpful that your doctor could prescribe for you. And there's a lot of other things that may affect that as well. Sometimes patients will have a chronic infection of their sinuses. Sometimes even acid reflux can get up into the throat and cause irritation. And sometimes it's two or more factors at the same time. So.
Yeah. What do you recommend then, let's say, for people who seem to get these allergy symptoms every spring? Just basically wait until you get the symptoms and then see a doctor, or be proactive in February and be armed?
Well, I think being proactive is very important. Some simple things that someone can do for more milder symptoms is just knowing the weather forecast, knowing the pollen counts, knowing that the pollen tends to peak from 5 in the morning to 10 in the morning. So avoiding outdoor activities during those times is best. If you're going to exercise, do it in the morning, indoors or in the evening after the pollen counts have dropped. You can make sure you're taking your allergy medications regularly scheduled, because once you have severe symptoms, it gets much harder to control. So get it treated earlier in the year. Start on a regimen and keep it under control, because once you're behind the 8 ball, it's much harder to get it under control.
I think we have time for one more phone call. Let's be brief. Mac, what do you say?
I say we've answered some of these questions already, but doctor, at what point do you see somebody asked about symptoms, and I've just spent the better part of 4 days with a horrible headache in the right, what seems to be the sinus. It feels like the nail in the eye. All around it, nothing over the counter seems to work for the pain or relief. Telephone conversation with my primary care physician, who we're now trying some steroids to see if that's going to relieve the headache. I have very few of the symptoms other than watery eye. There's nothing, maybe some clear drainage occasionally. I've been tested. It's been over 10 years ago with the skin test and found non-specific rhinitis. So I get the problem the one gentleman talked about, the drainage.
Okay.
9 months of the year. So at what point do you see an allergist?
Well, I'd say in your case in particular, when the misery reaches a certain threshold that I think you've reached. One point I do want to make is allergies go along with sinus headaches and migraines. Migraines often are a very common cause of sinus headaches. So I would have that, if you're getting these recurrent headaches, consider that mild migraines may be aggravating your allergies, and treating that from a headache standpoint might be your best bet.
Yeah. Thanks a lot, doctor, and thanks a lot for all the phone calls as well. That's Brian Rotskoff. Hope you get back to St. Louis one of these days, and if so, come on into our studio here at 1220 Olive in downtown St. Louis.
I would look forward to that. Thanks so much. It's been a pleasure.
Thank you very much. Brian Rotskoff, allergist at the Clarity Allergy Center in Chicago, St. Louis native with us. Okay, hey, when he comes back, we'll get him some Ted Drew's frozen custard. Why not? Ted Drew's has a couple of new flavors this year, including s'more, which is the chocolate marshmallow, and, of course, the frozen vanilla custard. And there's also, they throw in graham cracker in there, too. That's the chocolate, marshmallow, and graham cracker, plus the delicious frozen custard. Then there's